Hi. Prenatal maternal stress is associated with adverse birth outcomes. However, there seems to be a lack of common knowledge regarding non-pharmacologic stress management tools. By better understanding possible determinants of preterm labor, perhaps practice treatments can be altered to reduce the number of preterm births, which would lead to more positive outcomes for mom and baby alike. The purpose of this project proposal is to evaluate the effects of non-pharmacologic stress management tools, such as music therapy, on preterm labor. Guskowska 2013 suggests that stress during pregnancy is connected to delivery before due date, low birth weight, and a degraded psychosocial state of a newborn, and that relaxation exercises are a standard method of intervention for people with anxiety disorders. This study looks at the benefit of exercise and focused relaxation and compares changes in state anxiety and mood dimensions in pregnant women after both. Chang 2015 and Associates tested music therapy for the purpose of stress management among pregnant women. Beck 2015 chose to examine the effects of guided imagery in music, a psychotherapy intervention including relaxation, music listening, and imagery on biopsychosocial measures of work-related stress. His inspiration stemmed from the fact that music therapy has already been established as an effective method to reduce acute stress and anxiety in medical settings. Each randomized control trial used a convenient sample of prima-gravid low-risk pregnant women in their second or third trimester. These women were placed in groups randomly to either the control group or to receive some sort of non-pharmacologic stress management intervention, be yoga, music therapy, guided imagery, exercise or relaxation breathing, and progressive muscle relaxation. Granted, there were some limitations noted with inability to generalize results, recruitment barriers, or details such as specific types of music used. However, the results of these studies appear to be valid, reliable, and applicable to current practice. The value of these studies lies in the ability to prevent a major health disparity within a specific population. Based on this research, the investigator would like to propose an intervention group evaluation with a prospective pre-test post-test design, targeting the effects of stress management on preterm birth. There will be one control group that receives only traditional prenatal care and one subgroup receiving music therapy in conjunction with traditional prenatal care. Participants will provide a mailing address and receive a compact disc in the mail with listening instructions included. Levels of stress will be measured via the Pregnancy Stress Rating Scale and the Perceived Stress Scale. Both are 5-point Likert scale systems that evaluate different dimensions of perceived stress. Participants will complete the evaluations by mail, and all information will be kept confidential. The intervention group will comply with the music listening schedule in the comfort of their own home, on their own time, for the remainder of each participant's pregnancy. Post-test scores for perceived stress, along with statistics pertaining to the term of each pregnancy and birth outcomes, will be evaluated by the principal investigator and faculty advisor once all participants have delivered their babies and completed the post-test. The Healthy People 2020 goals include an objective to reduce the rate of preterm births from 12.7% to 11.4%. I believe that continued education in this preterm birth rate is important because approximately 1 out of every 8 infants was born too early in 2010. The post-test results evaluated for this project identified a significantly lower level of psychosocial stress in the experimental group than in the control group, particularly in terms of the stresses related to baby care, changing family relationships, and to maternal role identification. These studies provide evidence in support of the use of music interventions designed to relieve psychosocial stress in prenatal women. This is a type of intervention that, if it proves to have a positive outcome and decreased number of preterm births, could be implemented and used as supplemental therapy in conjunction with traditional prenatal care. Perhaps these services could be offered by clinics and even covered by insurance as part of a preventative healthcare plan. The author is grateful for the support and collaboration of her colleagues and facilitators. Thanks to all participants and their families for enduring the full extent of this study.